Okay. Thank you so much, Mohammed. I'm honored to have you here. It's morning time in the Philippines, and I believe you just got off from work. Thank you so much for making time for this interview. So let's begin. Hi everyone, welcome back to the channel. We have a special guest from Pakistan. Grateful that with LinkedIn we are able to connect with professionals all over the world. Today we're diving deep into the world of healthcare revenue. Let me introduce our speaker for today. He graduated from Allama Iqbal Open University and completed his Master of Education in Special Education and Teaching. He just started his new position as Client Relations at Edge. Before that, he is a Medical Billing and RCM or Revenue Cycle Management Specialist at 24/7 Consultancy. He's passionate about helping healthcare providers optimize their financial health. Ladies and gentlemen, please welcome Mr. Muhammad Habib Mughal.
Hi. First of all, thank you so much for this session, for my introduction, and for your greetings. So let me start. My name is Muhammad Habib. Basically, I am from Azad Kashmir, Pakistan.
Mhm.
So I have done recently my master in education from one of the top international university of Pakistan, which is Allama Iqbal Open University.
Mm,
So I have started my career in medical billing in 2020 from MTBC, Medical Transcription and Billing Company.
mm.
So I worked there for almost 1.5 years. At during that time, I worked on just AR, the AR follow-up on the claims and the denial
Mm.
management.
Accounts
So
receivables, correct?
yes.
Mhm.
So in start, I joined this field accidentally. I am not knowing much about this field, but once I
Yeah.
started this field, uh, I liked this and I
Mm.
interested in this. So I make this my profession. And after that, I joined MTBC after my graduation. It's a Bachelor of Science in 2020. So I have to continue my education. So I come to Islamabad, Pakistan, and I joined here my second company, which is ESR MD.
Mm.
So here I joined as a billing executive in start in
Wow.
2022. So here I worked on almost all aspect of the revenue, complete revenue cycle management, like patient scheduling, charge submission, authorization, verification of benefits, account receivable, denial management, payment posting. Also, I worked on the reporting side.
Mhm.
And I worked there for almost uh, 1.5 or 6 years. Then I joined 24/7 Consultancy as a backup team lead. And
Wow.
here, and there I got much of knowledge about the medical billing. There, my responsibilities are to manage my team, to respond the provider or the client's queries, and to assign the work to the users and to train the new users. So this all things help me so much in my field and to improve my knowledge myself. So I start 24/7 consultancy in February 2024, and now in June 2025, I left 24/7 consultancy, and today was my first day in Edge as associate client relations.
Mhm.
So
Congratulations. Yeah, we dive in really to your work profession right away. But yeah, let me just make this conversation live by asking you about life outside work, maybe family, passions, and your hobbies.
yeah, my hobbies, my favorite game is badminton. I also
Mm-mm.
play cricket, reading books,
Mm.
and nothing much. Sleeping.
Yeah, we need that. But your client is in Pakistan also or a US client?
No, all the clients are from USA. Actually, medical billing is most popular in the USA.
Mhm.
In
So,
Pakistan, it's not much.
so what time is it now in Pakistan?
It's 3:26 a.m., June 24.
Oh, so so you're working the graveyard shift, correct?
Yes, I'm working night
Yeah.
shift.
Okay. So I'm not really sure if because I was able to pass an interview with an Australian client, which is almost very close to Philippine time. So I'm grateful that I can work morning. So I'm like suggesting if you can find a client maybe that is aligned with your morning shift because I'm also concerned like with your health, well-being. Do you have options like that?
Yeah, but actually, the time zone in USA is totally different from us. Now there will be 5:27 p.m.
How about Australian account?
Australia, I have not much familiar
Yeah.
Australia, but I worked on the clients. All are from the USA.
Yeah, yeah, yeah.
I from the different states. I worked on the Florida, Texas, Georgia,
Yeah.
Mississippi, Louisiana, and any others, many others.
Yeah. I know the pay is really promising, but yeah, I'm grateful to find something that aligns with working in the morning. So I hope you also find that because I believe
Yes,
there's always a way we want to be healthy. Like me, I'm 41 already, and I feel like it's taking a toll on my mental health. So yesterday we
yeah, really.
interviewed a virtual assistant also specializing social media and content creation, and like she can actually do the work offline, and she's given freedom when to do that and not needing to be present with the doctors and clinicians. So that's my hope for you and prayer. So let's go to our next questions. Thank you for sharing your passion, your hobbies. Um, you studied special education and teaching, and I could like relate a little with pursuing teaching kids also right now. The second time I'm joining an ESL company also because I feel the flexibility of um, me opening slots that I can teach. And from teaching to billing, why is that? And was it just because you experienced billing roles? That's why you loved it and explored this industry? Or, yeah, would you pursue billing roles moving forward or also go back to special education and teaching?
Yeah, actually, I want to seek something, or I'm interested to seeking something at any time. So during my job, I thought that I have to learn. I am get the admission in uh, the university for teaching of education. Actually, in Pakistan, there is no any special degree for medical billing. So
Mm,
I just continue my education, and I think the teaching is one of the best profession. Also, teaching in I have to study about the teaching or education is the best. So that's why
yeah.
I continue my education in teaching, and that's all.
So, yes, thank you for sharing. As I was like telling you in our briefing, yeah, correct. You mentioned no formal education with medical billing. It's just
Yeah.
through our work that we learned about it. So, in the Philippines, or I think wherever, in the healthcare operations, healthcare virtual assistant can upskill either becoming medical coders or medical billers. And for me, I had an experience with my neurology practitioner that I was doing scheduling, calendar management, lead generation, scheduling patients for appointments, and also I was tasked to charge patients in their credit cards. And I feel like I'm also doing a little of billing, and they actually have an actual biller that I what's this you know coordinate with to complete the patient's financial requirements. So when I got an interview in a BPO, there was actually leveling of the billers, like billing biller one, two, and three. And they said that I'm in the biller three already, even I didn't have formal training on that. And I feel like, oh wow, really? I can actually call myself a biller already without really going through the RCM, overall healthcare operation. And that's privilege, right? Like through our experience, we can actually upskill already without going through the training. So, how did you learn about the basics of medical billing? Was it just through your experience as a biller for the company that you said there's no formal education? Yeah.
Yeah, first of all, as you mentioned, you worked on the patient scheduling, patient payment collection, or solve patient
Insurance
queries. This is also
verification, yes.
this is the part of the medical billing. So you
Yeah.
are
I
the
was
medical.
surprised, like, it sounds really complicated, but I'm actually doing it already and I'm happy. Yeah. I can put that in my resume. So yeah, did someone train you? Like how was your early days as medical billing?
So
The EHR,
I
you have EHR you're using, and what was that?
okay. So in start when I joined the my first company, it's medical transcription and billing company.
Mm,
Was in
that's
Kashmir.
another niche, right? Medical transcription.
Yes. So when I joined as a fresher, I was very confused. What's going on? What are these things? Because I have
So
no
far
any
from your
knowledge.
teaching background.
Yes. So at that time, I have no knowledge about what is medical billing or what's are the things going on. But I'm great thankful for my managers in my first company, my team leads who taught me how to do the things from very basic they start and I got it. And it will take time, but you got it.
Mm-mm, yeah.
So now I have almost 4 to 5 years, so I got many things. But in start,
Wow.
I was very confused.
Thank you for your vulnerability, how you started as a billing specialist. I want to share that one owner of an agency told me, I'm concerned about your stability. In 5 years, you were a healthcare VA, but you were in different doctors and clinicians. Actually, I realized, oh, I'm not stable because I'm having mental health issues already. But I really got a lot of experience, like exposure with the whole operation of healthcare already. Even I work remotely because I did scribing. I did the scheduling and all at the front end and a little bit on the back end of healthcare. So it's still a privilege, right? I mean, there are pros and cons with working night shift, but in that experience with my neurologist, wow, you were all around virtual assistant. Like, thank God. I mean, it's such a great experience also. Like, even we don't have training, formal training on it, we're able to like make it like just surviving the day with calls, with
Yeah.
the long wait with insurance verification, getting to the real agent. So yeah, let me hear from you. Please share about as RCM or revenue cycle, sorry, revenue cycle management specialist. Could you walk us through your understanding of the complete healthcare revenue cycle from patient registration to final payment?
Yeah. First of all, I mentioned that consistency is very important if you want to achieve something. So from previous 5 years, I am working in a night shift.
Oh, same
Uh,
with me. Okay.
also, this is my first job as a work from home or remote job. Before I have to go to the office.
Mm,
To, and from previous 5 years, I am hostelized in a hostel. I lived in a hostel from very far from my home. So I have to go to the home after 2 weeks, after 3 weeks, or after a month.
oh.
Yeah.
Yeah, amazing.
So that I mentioned consistency is very important if you want to achieve something.
Yeah. Yeah, thank you.
So,
Sorry.
no, go ahead.
Thank you for sharing. I mean, family time is really important. Like, I want to emphasize how we feel, fired up, joyful when we connect with our loved ones. So I hope even you want to be consistent at work, I'm reading LinkedIn, work life balance, self care, because I see that almost everyone in LinkedIn are leaders, founders, they want to make difference in their fields. So
Yeah.
with you, yeah, we can reconnect with your special education teaching background and still work in the morning. I don't want you suffering like in the future because it's my family suffering from my outbursts when I don't get enough sleep. So
Oh,
I want to free them from experiencing that. So let's continue. Describe a time you successfully improved a specific part of the revenue cycle, leading to tangible positive results. Examples are increased collections, reduced denials. What was your process?
okay. First of all, the patient calls to for the scheduling. In my previous company, we have a different department who schedule the patients. So patient call the department to schedule the appointment or through the portal like ZocDoc. Maybe you are familiar with
What is that portal?
ZocDoc for patient scheduling to any doctor.
I think I
Patient book the
heard about
appointment
it,
through
but I wasn't able to, yeah, try that
Yeah,
yet.
patient booked the appointment through the portal or through call, and she provided her his insurance details.
Yeah.
So our VOB verification of benefits department verify the patient's eligibility, that patient insurance is active or not,
Yeah.
and how much is the patient responsibility, like the copay or the deductible or out of pocket has been met or not yet. If not,
Mm,
then we will inform to the patient that your deductible is not met yet, your claim will process in the deductible, or that amount is your copay amount you have to pay
mm,
at the time of the visit. So we have, and also we verify the authorization is required for the services or not.
yeah.
If the authorization number or the referral is required, we have to apply first, because some of the insurances did not allow to give the retro authorizations.
Yeah.
So we have to apply it prior. So we have verified all the details and inform to the patient. And then patient get all the details and visit to the doctor's office and get the services and go back. And after that, the doctor office sent us to all documents like what the patient disease was or what the procedures was performed. So the next step is our coding department code the disease into the ICD-10 or ICD-9.
Yeah.
Also, the procedures are performed. They convert it into the CPT codes, and then they send it to us. So they send it to the another department, which is their responsibility is to charge submission.
Mm,
So they enter all the information in the system, in the EHRs. I worked on the multiple EHRs like the Care Cloud, Advanced MD, Tabra, which is also known as Cario, Intake You, Simple Practice, and many others. So
wow.
the the department that handling the charges, they enter all the information like what procedures are performed or what the diagnosis codes are. They enter all the information and send the claim to the insurance. And
Mm,
after 10 to 15 days, the other department or the same one follow up with the insurance to get the status of the claim. The claim is paid or not. If the claim is not paid, then to get the status why the claim is not paid. Is there any denial or insurance required any information? If insurance required any information like medical records or anything else, we will provide it to the insurance.
mm,
And it's our responsibility to get the claim paid. And one more important thing in this complete scenario is a charge submission. If we verify that first the procedure, diagnosis, or the patient insurance is active or not, then there will be very less chances of get denied.
mm,
So most important thing we have to verify first the uh, patient verification or patient insurance verification and charges verification like procedure, diagnosis codes, and then we have to submit the claim.
mm,
And after that, we receive the payment from insurance. We are post in the EHR, and if there are any patient responsibility like deductible process,
yeah.
insurance process the claim, deductible co-insurance, we follow up with the patient to get the payment.
Mm, mm. So thank you so much for explaining in detail the process. So let me just go back. Like, as I verify insurances of patients, I remember I was really dreading to call insurance agents because of the long wait. I know there's queuing. What do you do with that? Did you just get to embrace waiting to get to the agent, or is there a technique how to shorten the waiting time with insurance verification?
Yeah, actually, some of insurers have long hold time, like the BCBS, Blue Cross Blue Shield, which is
Oh,
the large commercial payer in the
mm,
USA.
yeah.
So the best thing is to create the web portal for every insurance. If we
Mm,
have a portal, we can verify all the details that provider is in network or out of network with that insurance, or what will the patient eligibility is active or not, the authorization is required or not,
mhm,
or what will a patient copay. All the details we can get through the web portal. So it's easy if we create a web portals for every
mm,
insurance.
So, yeah, I think it's about enrolling the provider with the portals, correct? And then also it helps to try availability, right? But for some billers, they don't find it really helpful. Sometimes there's discrepancy with insurance information of the patients calling the agent. Sometimes the patient also tries to defend, oh, we paid the deductible already. No, 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 no. What do you do when there's some conflict or discrepancy like that? There's
Yeah,
disconnect.
sometime
Yeah.
it happened the information that's showing on the web portal is not correct.
Yeah.
On the web portal it is showing that the patient is responsible for $20 copay, but when we call to the insurance, the representative provides us the different detail, like the patient is responsible for
Yeah.
$30 copay
Maybe the
or that thing.
representative has not slept yet. Okay, go ahead.
Yeah,
Uh,
so for this one, not for the mostly patient but some, yeah. So for then for these ones, we have idea about the insurance, which insurance information may be incorrect. So we have to call to the insurance. We have no any other solution for that.
mm, mm.
So we have
Did
to call to insurance and get the reference number
Yeah, did you have like an
because
iron? Sorry about that. Go ahead.
uh-huh. So because when we call to insurance, we have a reference number. Next time, if the representative provide us the wrong information, then we have the reference number. We can claim that you provide the information or your
Oh, now I
colleague provide the
know
information.
the use of the reference number because sometimes I just say, okay, thank you. And then I don't really write it. Okay, so yeah, we can go back to who was the agent that gave us the information, right? Thank you for that. So my next question is, did you have an irate patient that insisting, oh, we're done with the deductible. I don't need to pay for anything. Go ahead.
Yeah, mostly patients. Actually,
Were you stressed? How did you handle it?
in my previous company, we are working on the mental health, the practice, and the patients are very.
So funny. Yeah, they have
So
triggers. Their
yes,
insurance triggers them. Sorry about that.
it is very difficult to convince the patient about their balance. Some of the
Yeah.
patients, they don't understand that they're sad. We have no balance. We already paid the balance. It is never not our responsibility. Even if the patient insurance is inactive, we verified multiple times insurance is inactive, but patient said that my insurance is active. I have multiple times, I have called my insurance is active. So it's very difficult to convince the patient.
And then you come to a
So
point like, we are sorry, we can't really schedule you for an appointment, right?
yeah, but uh, after the long discussion, patient got it, but it is very difficult to convince the patient about their
Yeah.
balance or about their responsibilities.
Yeah. I was in your LinkedIn before. I don't know how long were you in the 74 24/7, like 24/7. I mean, at least you close the office, right? The consultancy. You have others shifting in the schedule.
No, it is the medical billing company, but the name is 24/7 Consultancy.
Oh, okay. But you still have time to sleep, right? Because the title 24/7 as if you're not sleeping. So
No, it
So funny.
was 9 hour shift,
Okay.
and I have a lot of time for sleeping.
Yeah. I actually had I passed an interview for a billing specialist role, but it's actually 10 hours. I said, "Oh no, if this will be the same experience with a neurologist, I wouldn't want to accept this." So I was like my boyfriend telling me, "Let's trust God, let's leave the contract and wait for your Australian morning shift." But we have a job already, we have a contract already. And then I realized it's in obedience, humility. And God made me pass also the morning shift. So yeah, I mean, I was so greedy. I need money soon. I wanted to sign the contract, but I also want to prioritize my well-being. So let's talk more about the last things with billing, and then let's go back to advocating well-being. So I want to learn because I recently learned that following up, collecting the patient's responsibility is what AR is. Accounts receivables, correct?
Yes.
And then now I have a question about claim denial. Since this part I'm not really knowledgeable yet. So, what are common reasons for claim denials and what steps do you take to prevent them proactively? How do you approach appealing a denied claim? Did you get to touch that part of the operations?
Yeah, we have received the common denial like the missing information, or if we submit a claim duplicate time, a same claim. The first one, insurance insurance process the first one and denied the second one as a duplicate. And after that we have received the multiple denials for timely filing limit expired. Every insurance have a time limit to receive the claim from the date of service. Like some insurances have 30 days, some insurances have 90 days, some insurances have 120 days, and the
Mm,
Medicare, which is a government payer, have
yeah.
it's a 1 year timely filing limit. So if any of the reason from the doctor office we have received the late billing, the insure the patient demographic or patient super bills we received late, then definitely we submit claim to insurance lately. So this is one cause of their denial, the timely filing limit expired. So sometime if we submit the initial claim, insurance denied the claim due to some reason like the diagnosis code or procedure is incorrect.
Mm,
We submit the claim to insurance, and second time insurance denied the claim as timely filing limit expired.
mhm,
Sometimes insurance denied the claim incorrectly because the first claim we have submitted in time, and the second one, the corrected one, is out of time filing limit. But this is not our fault, and insurance will reprocess the claim if insurance denied any claim with due to this reason. Because they look the first claim. If the first claim is submitted in the timely filing, they will reprocess the claim definitely. And after that, we received the other coding denials, like the procedure code is incorrect or procedure code does not match with the diagnosis codes. This procedure cannot perform on this disease. So at that time, we have a coding team. We have sent the medical records to coding team to review again and provide us the correct diagnosis codes and procedure codes.
mhm.
And many other denials, like some insurances require the medical records to
Yeah.
review the procedures and diagnosis codes. So they deny the claim as the medical record required. So we have option to submit the medical record through the fax or through the portals or through the mailing address. And after that, we receive the denial like missing information, insurance or patient insurance terminated, or the patient information is missing, like the date of birth is incorrect, or these types.
Mhm.
So these are the some common denials.
Yeah. So thank you for sharing. I mean, I see from our job, it's really important to really be correct the first time because it will cause, resources, time, and efforts of the team if one person makes mistake with even just one digit correct with a code, with a date of birth, and all that. So I see how
Yes.
important our role is in the healthcare. So yeah, we just have a few minutes. So can you just give me tips for our aspiring virtual assistants, especially the healthcare virtual assistants, because this is something I know they can upskill in the future. So let's encourage, the students or aspiring VAs to just embrace the role and take the risk. I mean, will always be able to find a way, even we don't know things yet uh in the first place. So what can you advise aspiring bees, because some of them, like, still in the corporate or in person job, they want to keep it because maybe they're in the management roles already, receiving big pay. What can you tell them? For me, staying home is the best. I'm preserving my energy for the ones I love, and I can do much more things than travel, hustle, and traffic. Go ahead.
Okay, in our field, it is very important to review the every information. The first of all, the department who is handling the verification of benefits. It is very important to verify each and every information very carefully.
Yeah.
So if anyone verify the information like the insurance coverage is active, we inform the patient that your insurance is active and you are eligible to take the services. But later time we verified that the insurance is inactive. In start we made any mistake, so it will be very difficult for us to manage that or to convince the patient after that, because we already informed her or him that your insurance is active. So it is very important to verify all the information first. First of all, verification of benefits, or we have to verify the authorization is required or not. If we not verify and after that insurance is refused to pay because the prior authorization is required, and insurance also does not allow to get the retro authorization, so it
Mm,
is very difficult to get the payment from the insurance.
mm,
So after that, the second coding department have to very carefully verify the medical records to verify or to get the procedure or diagnosis
coding.
ICD-9 or ICD-10 codes. And yes, coding, it is very important to do coding very carefully. And then charge submission. It's also a responsibility of the team to verify again all the information before
Mhm,
charging, which the patient insurance is active or not, or all the information like pay member insurance ID or procedure diagnosis is correctly entered in the system.
mhm,
So verification before submission is very important. If we verify first, then there are very less chances to get the denials. If we will submit the claim without any verification, then we will
mhm.
receive multiple denials, and it will cause the delay of the payment or revenue.
Awesome, awesome. Thank you so much for sharing, Muhammad. I'm thinking about having a webinar with you teaching students how to become medical billers in the future. I hope you would have time for that. But for now, I would let you rest. So that's all for today's session. If you're ready to transition to the VA world, maybe you're a nurse, med tech, want to become a healthcare VA, please join our Thrive Freelancing Academy. Don't hesitate to reach out. We'll work together on mentoring sessions of a CV revamp in Canva and optimizing your profiles in LinkedIn, JobStreet, and Indeed. Just send me a message. Thanks again for tuning in, everyone. Thank you, Muhammad. We'd love to have you back. All the best and good night to you. I'll see you everyone next time. Bye bye.
Thank you so much. You are also mentioned that you're nurse, right?
Yes.
Okay. Also, you're
You
doing
have some
the
questions for me, sorry.
yeah.
I thought we are going to end the vlog, but yeah,
I
let's continue. Go ahead.
you
Are are you
are
want the conversation off this recording? Is that okay?
yes.
Thank
Yeah.
you. Thank you. Stop recording. Bye.